Hello, Allie. I really enjoyed watching your video on advocacy, and I think that you actually summarized it really well. And I'm glad that we both agreed that advocacy is one of the most important core values that we can have as nurses. So I made a couple notes of some awesome things I think you mentioned. First of all, I think we definitely, a good way that we advocate is by giving recommendations. We can recommend things obviously to physicians, but not just physicians. We can recommend things for our patients to the patient themselves. We can recommend to family. We can recommend to physical therapy, occupational therapy, speech therapy, any testing that we're having. We can constantly make recommendations for the good of our patient, and I think that that's one of the best things that we can do, because after all, we're the ones who's spending the time with the patients, and we might know them better than some of those other fields. And you also mentioned how the patient's perspective is ultimately most important, and I also agree with that. And then I like how you went into basically advocacy is what this profession is built on, all the way back to Florence Nightingale and how she found out that injuries were not always from war, but maybe hygiene. So I think that was a great example, and overall I think you summarized advocacy very well.